Okay. So we're in the middle of talking about this, and I realize I want the coaches to watch. All right.
Okay.
So, Dr. Mensa, what we're seeing when Linda fills this out is as she fills out the case acceptance tracker, she's putting in new patients. Well, it's the same new patient.
Mm-hmm.
Okay. So it's really one new patient we presented to in January. Now, that's why I said maybe this isn't accurate. Do you have an idea how many new patients you saw in January?
No, not
Okay.
off the top of my head.
Sure. So maybe it's accurate, maybe it's not. Okay. 20 existing patients, not bad, right? Probably see 15 new patients is the goal, and probably you would see about 30 existing patients we presented to. All right. Now,
Mm-hmm.
so we presented to 22 patients, one of them duplicated, but 22 patients for a total of $30,000. The average case size is $1,400. Now, the reason that's low, I want this typically at a $2,500 minimum average case size. The reason it's low, though, is because you don't have 15 new patients. Which treatment plan is typically larger, an existing patient or a new patient?
New patient.
New patient. And so when you have a, I don't know, $5,000 average, $10,000 case, right? An Invisalign, right? You know, those types of dollar amounts you're presenting, the more new patients we're presenting to, the higher this average case size is going to go up, which is a healthy thing.
Mm-hmm.
So I'll tell you a story. So a client I worked with started using this a few years back. Their average case size was about 1,700. You would see about $70,000 a month in here that they were presenting to. Now it says $140,000 they're presenting to.
Wow.
So by monitoring it, you start changing what you're looking at when you're starting to do these presentations. And the more you get Linda involved with, hey, let's look at this. Let's see how we're doing as the month goes on, right? We're in February and you start looking at this. Hey, we've got 9 and no new patients. How come we're not presenting any new patients? What's going on?
Wait a minute. Because we had scroll up a little bit. I mean, okay, this is wait a minute, what about because this Randall Wilson,
Yep.
okay, we just presented a case to
Yep.
him.
Yep. February
Uh
7th. Yep. Is that a new
so
patient?
I suppose she came in last month to get his teeth cleaned.
Okay. So that to me looks like a new patient and you would put the date over here.
Yeah.
Yep.
And that Muhammad one, yeah, these are all the last three there are February's.
Yeah. Yeah, they're
Um,
all February. The question is, what has to happen is if they're a new patient, you put the date in this column. If they're an existing
right,
patient, you put the date in this column. Now look at this. Look what's happening. You see that difference? Remember you
right.
said January was a real bummer?
You're right.
Look at that average case size compared to January. It's more than double. It's tripled.
Mm-hmm.
That's a really, really good thing. Okay? Make sense so far?
Yes.
Okay. Now, what we have to do, and you can coach her on this, sit down with her. Everybody who schedules needs to have a date in this column, right? We need, because
Okay.
if we're scheduling 100% of the people, what's the date? I need the date in here. See, this said she would call, will call to schedule. That tells me we didn't schedule any of these.
No.
And so there shouldn't be a dollar amount in here. I don't want to take this out. I'll take it out and then I'll put it back. Okay. So see what starts happening? That our percentage of people that are scheduling is going down as I take that out. And then we got follow-up. That's what this follow-up column over here is for, right? So looking at financial options, needs to talk to his wife. Because there's no date here, I'm wondering if these are supposed to be empty. Do you know if Randall Wilson scheduled?
No.
Okay. So
Uh,
this is a really, really, really good living, breathing, working document that I want you guys working on together with. And in order to do that, I want you to understand what each column means and why we fill it out. Okay.
yes.
So, so new patient column, if they're a new patient, if Tina was a new patient, you'd put February 1st over here and not here. If she's an existing patient, we put the date in that we presented right here.
Yeah,
Put her,
she is an existing patient.
perfect. This is done correctly. Put her name in, what we presented, great size, love it. And it looks like she has buy-in. She's going to do her down payment. Do we have a date for her? If she is scheduled, we'll put the date here and the dollar amount she schedules. Now, if she hasn't scheduled anything, we don't put any dollar amount in that column.
Okay. I
That's
don't know.
scheduled at presentation. Okay. So you can work with Linda on that to see how we're filling this out.
Now, do you
Now,
have something that has what each of these columns mean?
yep, right up here at the
Okay.
top. Right up here at the top.
Oh, okay.
Scheduled at presentation. That's the dollar amount we schedule at presentation. The scheduling date goes in here.
Okay.
Treatment proposed dollar goes in here. And she knows how to fill it out. I think what you got to check with her is, hey, why did we put 7,600 in if we don't have a date? Either both of these have to be filled out, the date they're scheduled and the dollar amount they scheduled. Either both have to be filled out or both have to be empty.
Okay.
Okay.
So once they schedule, then you put a dollar amount.
That's
there.
right. Until that, yeah, it would look like this. And so what happens is our percentages start to go down. Right. So if these people haven't scheduled, we're not 95% acceptance. We're at 67. So I'm very excited that in, I don't know, what's today? 10th? In 9 days in the month, right? We've only had so many working days. We've presented 35,000. I better put these back in. We presented 35,000 so far. In January, we presented 30,000. We've already out presented January. Now that's why I started out saying I'm not sure this is accurate, but you did tell me January was really slow, right?
Crap.
Yeah. So this is a really, really, really great tracker for you and the team to dive into, really talk about, understand, because here's the deal. If those people really don't schedule, you got this follow-up column over here. Hey, Linda, where are we with Randall Wilson talking to his wife? Oh, they're going to let me know on February 16th. Okay, great. Let me know. And so February 16th comes around. Hey, did you ever hear from Randall's wife? And you're asking questions as a leader. You're not saying a question like this. Did you end up talking to Randall's wife yet or not? Right?
Yeah.
You're not doing it like that. You're saying, hey, February 16th, I think you on the follow-ups, tell me what's going on there. Did you ever hear from them? What's going on? All right. How can I support you? Right. These are great cases for these two patients, right? Muhammad and Cotton. How, where these are ortho cases. Where are we following up with them? What can I do as the doctor to support you in that follow-up? Do you think I need to schedule a Zoom follow-up, no charge consultation with them? Should we show them what the after will look like when their teeth are straight? What can we do? What do you think will put them over the edge? Do we need to get more financial options? Are you guys using, didn't we talk about Sunbit? What are we doing for financial options?
We're doing Sunbit and Verity.
Yeah. And is it working well with Sunbit?
I mean, both of them are, the ones that the case that they're paying up front, that's great. Just the ones that are.
Yeah, of course. Yeah. So make sure, with Sunbit, they're going to give you money. Now, if you want to be the bank for ortho, I'm okay with that, but they got to put $2,000 down.
Okay, right now it's $1,000.
Okay. You got, what's your lab bill for the case?
For ortho?
Yeah. Because you're doing brackets and everything, right?
Right.
Yeah.
So could be anywhere from 600 to 900.
Okay. So just as long as your lab bill is being covered, I'm okay with that. And then making payments, that's fine. Every single ortho case, when we work with orthodontists, we should have 100% case acceptance on ortho because they need it. Right? It's a kid that needs it. And financially, everybody can afford ortho. Why? It's $1,000 down, right? Let's just do the math. So we do, so it's $3,950. We'll call it $4,000 left if they put their down payment, right? And how long are they in ortho for?
Year and a half.
Okay. So we'll go 12 months of payments. Can you afford $333 a month?
Okay.
Okay. Right. Okay. So all right, put 1,500 down. Now we're at 3,500. Can you afford $292 a month?
So take ortho from Verity and Sunbit and just go back to.
Because if they don't qualify, you don't get the case.
So when you say they don't qualify, so they don't qualify Verity or what? What do you mean?
Yeah, let's say they go to Sunbit and well, here's the deal. Look, if they can qualify through Sunbit and you get the $4,950 now and they're making payments to Sunbit, Perfect. Let's just keep doing that.
Okay.
But let's say they don't qualify for Sunbit or they don't want to pay the interest. Okay, then let's do a down payment here of 1,500, and we'll take payments on that. Because here's the deal: two things. One, you're never going to finish ortho until they've paid.
True.
Okay, they're just going to maintain ortho forever if we have to. Those brackets are locked on. Number two, the more start. So when we do an ortho, let's say we're coaching an ortho practice, we have our goal is 25 starts a month.
Okay. Yeah.
Right. So if you just take 5,000 times 25, we got our 125 a month that we're trying to hit in an ortho practice. All we care about are those 25 cases paying $1,500 down. Okay. And then every month, think about this. We just did 25 starts. Okay. So every 4 months, we have 100 people making payments.
Mm-hmm.
And they're all paying $333 a month, let's say. Okay. And every month that goes by, it gets bigger and bigger and bigger. It's only going to take 8 months for it to balance out. And then it's forever. You're always collecting the same amount you're producing. It starts to balance out. You'll produce 125 and you'll collect 125. So it just has to get to, what did I do here? 100. Yeah, 4 months. So at 200, and this is just a simple example, you start adding these numbers together in the down payment. That was 200, 25 every month. But you start getting, multiple months doing this, it starts to add up real quick. And when we have our tracker in place for ortho, 125 produced, 125 collected. Because you could be the bank for ortho and everybody says yes. So let me just take all this out. What is this? Yeah. So there should be everybody should be able to afford $250 a month. Okay. So Linda just tells you, hey, they're a 1,500 down, $250 a month. It's going to take them 18 months to finish payments. Guess how long your treatment is going to last for their ortho
18
doctor?
months.
That's exactly right. 19 months.
Okay.
Yep. Does that make sense?
Yes.
All right. So all of these patients should be saying yes on ortho if you're doing brackets.
Yes.
If you're doing clear aligners, it's a little bit different.
No.
How you do it is it's 2,000 down, so bigger lab bill, and you don't even hand them new aligners unless their payment. You can still take payments, but their payments got to be up to date. You don't hand them aligners until it's done. They don't go, yeah, can you give me like 4 months worth of aligners? You'll never see their money. They'll just take the aligners and go. We don't do that. You have to. The whole reason they're not doing Smile Direct is because of you. You need to monitor their progress.
Mm-hmm.
All right. Is that okay?
That's great. I like that.
All right. Find out if these cases did not move through because it says researching best financial options.
I will Monday go through that and tell them the best financial option. We'll just go back to in office.
Look, I'd rather you get the money up front through Sunbit, but if that's not an option they want to do, or they don't qualify, or they don't like the interest rate, 1,000, 1,500 down,
Well,
take payments.
You know what? If they've got the money to do up front,
then we take that.
Yeah.
Yep.
Yeah,
absolutely.
because Sunbit is still, yeah. Okay.
Yeah. Okay. Because you're going to pay a percentage to Sunbit.
Right.
I'd rather you just be the bank on ortho only. We do that. Ortho only.
Understood.
Yep. Okay. So we've got a couple here. This looks great. So January, yes, looks really, really rough from this perspective. Here's what I want you to hear me on. And it doesn't look like these people said yes because there's no date there.
Mm-hmm.
Wants to wait for taxes. So let's say these are not filled out, right? All of a sudden our number of people starts dropping down. I'll show you what this means. I don't know. They said yes or not. Thinking about treatment. Yeah. See, we'll call us. These don't look like they should. I'm not sure. Okay. So maybe she's going back and filling out. That's a nice ortho case that says yes. I don't know. Why does it say 4950 presented, 3950 accepted?
I don't, who's that patient?
That is Sotera Kradolf.
That's a good question because the ortho should be, unless that's insurance.
Okay, it could be insurance discounting the fee. Then we should be presenting 3950 and 3950 accepting, right?
Well, no, if they pay $1,000, if on insurance they have $1,000 coverage for ortho.
keep this 4950 because we're gonna get 4950 for that case.
Right.
Some from insurance, some from patient. So
I
figure
think she's
out.
talking about her patient paying
Yeah, no, it's the total
39.50.
amount money that we're gonna get. Yeah,
Okay.
yeah. This is a dollar amount scheduled at the time we present.
Okay.
Yeah, I don't, I'm assuming we'll collect the money later. Okay. What I want you to understand is that we want 80% of the people, okay? This is the number of people, 80% of the people scheduling, right? So we're at 19 out of 22 people scheduled. That's 86% scheduling rate. That's pretty good. Okay. And then
Okay.
we want at least 60% of the dollars that we present to be scheduled.
Wait. Go back. You want 80% scheduled.
80, let me say it this way. We want 80% of the people we present to schedule an appointment.
People.
Yeah. So when people, let me say it this way too, Dr. Mensa, when people say, what's your case acceptance rate? Oh, 85% case acceptance rate. Well, of 85% of what? So I'm breaking it down into two categories: number of people who schedule and the dollar amount they schedule. And what's realistic is an 80% of the people scheduling something. And of those people that schedule, we want 60% of the dollars to be scheduled.
Okay.
Got it?
Right. 60% of those who schedule.
60% of the dollars to be scheduled.
Okay, from the 80% of the people.
That's exactly right. Yep. So if you look at this column, you look at this row here, it's talking about dollars right here. It's talking about $30,000, $16,000. We scheduled 52% of the dollars we presented. And in this row, it's talking about number of people. 22 people presented to, 19 of them scheduled, or 10, I'm not sure which. We're either 50% or we're 86%, right? We want 80 over 60. If you look at February, you tell me we're at 95. Okay, now let me give you another example. I'm okay with this because this amount is nice. This is a nice $4,000 amount, but a lot of times what I see is a very low amount here and a very high percentage of dollars scheduled. And what that tells me is we played it too safe. We're just presenting little things for people to do, and everybody says yes. That's not going to grow the practice, and this amount's going to be too small. You can't look. What's your monthly goal? What do you want to produce every month? What's your goal?
Okay, what I would like to do is have at least 10 implant starts a month.
Okay.
And even if it's 10, 20, 10 ortho starts.
Okay.
Okay. That's 49,000 on the ortho part.
Okay.
As far as, if they all commit to treatment. All right. But if they're putting 10, XYZ down, okay, if they're putting 1,500, 2,000, I don't have a calculator, but
yeah.
So
I'm not worried about the collection part. Let's just focus on the production part.
Okay.
Production doctor goal per month.
So that's together those two.
Yep.
As far as starts, we're starting $1,800 times 18 times 10. That's 18,000 on the implant part, and 49,000 on the.
Okay. So we'll call it 65,000.
Yes.
Okay. All right. So implants and ortho.
And then the others is gravy.
That's right. Now, when you look at this, trying to get to 65,000, and I know February is not done. January, I'm not sure how accurate it is, but if we present $30,000 worth of dentistry, are we going to schedule 65,000? Impossible. No. Can't get there. So that's another reason why this tracker becomes so powerful, because what you'll start to see is we need to present $100,000 to get 60,000 scheduled. We get that 60% dollar range. In order to do that, we got to have enough people. We got to have enough new patients. We got to have enough ideal case presentation and ideal treatment planning and everything. So let me show you. Let's see what tracker I'm showing you this screen. Let me go to real quick that office I was talking to you about. We'll go way back when. $2,800, not bad, right? 3,300. Look at, see, there's that 114 I was talking about.
Where am I looking?
Yeah. So you can see their total dollars present. Oh,
I
I'm
don't
not sharing my
see.
screen. I'm not sharing my screen.
Right.
Sorry. Give me 1 second. I thought I was sharing everything. There you go. All right. This is way back in 2017. When we started doing this, check this out. $78,000 presented, $1,900. We started that in March. Okay. By September, 114,000 presented, 3,300. So you see how it's moving in the right direction?
Right.
Now you only had 8 new patients, only 26. It's not a very big practice. It's very similar to you. Implants, does a lot of implants. Okay. You can see them here, right? $15,000 case, $17,000 case. That's what's going to make the difference. Look at my 80-60 ratio that I want. I'm okay with that. Now, his monthly goal, you said 65,000. His monthly goal's 70,000. No, his monthly goal is yeah, 70,000 a month. So he knows he has to present 114 to get to 70. Look at this. He knows he's gonna hit his monthly goal already because he knows what's scheduled at presentation. And if it's not, Leilani, his office manager, is gonna go follow up, right? Present 100 to get 70. That average case size, total dollars. You see how this works? Okay. So if we can use this same tracker in your practice the same way, where it's a compass. Every day you guys are looking at this from yesterday. What you measure, you improve, right?
Sure.
All right. You make this a living, breathing, working document, a compass in your practice. You're going to start to see that same number get to that 65,000 you want.
Okay.
You're going to start focus on it. You're going to get it. All right. What's standing in our way? What do you think the big objections are to getting there right now?
One, getting the tracker done.
Okay.
I mean, doing getting it done and done right.
Yep. And it looks like we're finally moving in that direction with Linda doing it. That's excellent. So appreciate her for that, right? Pavlov's dogs. The more you appreciate, reward her doing that, the more she's going to do that. Thank you so much for filling this out. This is going to help us so much. Okay. All right. So we're going to go 65,000 per month doctor side equals what's standing in our way. Filling it out. And we'll let Taz do the other tracker. We'll get that going. All right. What else is standing in our way? How can my phone be on vibrate and it rings? That was annoying. It's time for an upgrade. Don't they get you on that deal, man? They're like, oh, it's only $20 a month for 4 years. It's like buying a car.
Yes. What's standing in my way?
Filling it out.
Yeah.
I think enough new patient flow. Remember our meeting? We called that emergency team meeting to talk about, hey, on that phone call, we do everything in our power to get that new patient scheduled.
It's interesting. And the question is, is this more than, well, my son called, he has a friend who called and said, this guy's been trying to get in and he hasn't had any callbacks. So I need to go back and start go through the calls and see when people call, what is happening.
All right. Here's what I want you to do. When you look at that first column in the tracker and it says number of new patients, 0. Hey, how come we don't have any new patients in here yet? Like, I want you to ask the question of the team. Keep them focused on how do I make sure I convert new patient, do everything in my power to do whatever this patient needs to get them in the practice. When did he call and leave a message?
I don't know. I'm going to go back and, I'm going to call the gentleman and then ask him when he called.
And then why don't you go ahead and schedule him?
Yeah. I guess I could do that.
Because you're going to go to Linda and Taz and go, hey, I have this caller who really wanted to get in, said he didn't get a call back yet. I was on the phone. I thought, you know what? I'll just get him scheduled now. Just show them. Lead with that example. Not
Okay.
like, hey, I did this because you couldn't do your job. Just go, I'm on the phone with them. I thought, you know what? I tell you guys all the time, get them scheduled when you're on the phone. I'm going to get them scheduled when I'm on the phone too. I have no idea if I did it right. You need to register them in the software, whatever it is, right? Okay.
The other thing is we're having this Next Health, which which we started implementing. Uh, they People have the ability to go on the schedule and schedule.
Okay. Online
Okay.
scheduling. Okay.
And the forms, they could download the forms or they could fill out the forms. Um, and so with that, after I hear more of it, then I can go on my messages when somebody calls, please go to mensadental.com and, you know, look at appointment times.
So the voicemail they hear from you is, hey, if you're calling to schedule, go ahead and go to our website. You can schedule online there too. And until we, okay, perfect. Yeah. Is
Yeah,
that on
yeah. I
there?
think that'll get people more on the
Okay.
schedule
All right.
and get us more moving.
Great. We have a higher no-show rate for online schedulers. So do me a favor, an action item for your team when someone schedules online and they fill out their health history forms online. Remember, we're going to do the doctor medical history review call. You're not going to do it, but Linda or Taz is going to do that. And here's what they're going to say. They're going to call the patient or text them and leave a message and say, Ricky Bobby, Dr. Mensa asked me to give you a call. He has some important questions regarding your medical history that we need to review with you before you come in for your appointment. It's essential that I talk to you today or tomorrow. Please call me back at. That's it. If that patient doesn't call you back, that's a huge, huge concern, right?
Okay.
They call you back. Okay, I'm going to go over the medical history with you. I see this, this, and this. Have you ever had to pre-medicate because of heart conditions or concern or joint replacement or anything like that?
Okay.
Okay, good, good. All right, perfect. We're all clear. We're ready for you this coming Tuesday at 3:00. We look forward to seeing you then. Do you know where we're located? Okay. You just prompt, ask a question. Prompt, ask a question. We're expecting you. We're looking forward to seeing you. Say something like, so I've reserved an hour of my doctor's time just for you. He's going to be spending an hour with you. What? Oh, that's different, right? They're already thinking this is something different. So remember we talked about NLP, the framing, the things that we say. Everything we say is about making sure they get the appointment scheduled and they keep the appointment.
In fact, I asked Angelique last week, and she started doing it Thursday.
A day early.
Even though, yeah, last Thursday. Even though
Okay.
Taz is also, with all the different electronic stuff, send them messages and all that. Taz still calls to
Good.
confirm. But I'm also having Angelique just calling to introduce herself.
Yeah.
Okay.
As the
Not doing
hygienist.
anything. Yeah.
Yeah.
Hey, I'm the hygienist, just calling to see,
Beautiful.
so
Yep.
that I feel will, create more value
Yeah.
to the
We do
patient.
the same thing. We have our doctors do that call. Yep. So have Angelique do it for a while, because they're seeing her first. That's totally fine. When they're going to see you first, you call and leave a message. You call and leave that
Okay.
message and say, yeah, I'm sorry, Ricky Bobby, I missed you. This is Dr. Mensa. I see you're coming in for the first time to our practice tomorrow. I can't wait to meet you. I look forward to seeing you. Bring all your questions. We'll see you then. It's not meant to replace the courtesy call. It's in addition to everything. How many new patients do you see a day, right? So how many of these calls are you really going to make? It's not that much. You do it during the middle of the day. Nobody ever answers their phone. If they do, you're just saying hi, introducing yourself. See you tomorrow.
Cool.
Yeah.
Okay.
All right. Let Angelique do it for a while, and then if they start seeing you for any reason, then we can also do your new patient call as well. Okay.
Mm-hmm.
All right. What is standing in our way of getting the tracker filled out, or getting to 65,000? So filling out the tracker, enough new patient flow. So let's get the team calling people back. Online scheduling, whatever it is. And I would also say ideal treatment planning. Now I'm just a stab in the dark. I have no idea, but I want to make sure every time you're treatment planning, every time existing patient, new patient, whatever, it's full mouth. It's full mouth. It's not, hey, we're going to start with this tooth or this area in the upper right. We're giving them every opportunity to do everything in their mouth. They have the whole plan, and then they could do bite-sized pieces after that if they want. Okay? Is
Hmm.
that fair?
Yeah.
Okay. Whole mouth. All right. I think that's enough for today. What is that? Any other challenges on your end? Concerns?
Uh, I guess the longer they stay with me, the appreciation,
Mm-hmm.
appreciation. I guess I'm not showing them appreciation enough.
Mm-hmm. 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 It's great that you're willing to acknowledge that and admit that.
Well, I mean, when I talked to them yesterday,
Mm-hmm.
each individually,
You did your
uh,
one-on-ones.
yeah, one-on-ones,
Mm-hmm.
it was interesting. You know, um, Taz and Raquel were good. We're okay. Um, but for some reason, um,
Linda and Angelique.
yeah, Linda and Angelique, um, before we moved to our new place, yeah, we had a big room.
Mm-hmm.
And when we had our meetings, I would buy them coffee, donuts, whatever.
Mm-hmm.
Okay. Um, since COVID hit and we're trying to regroup, getting things back,
Yeah.
I guess every once in a while, yes, I'll buy them lunch.
Yeah.
For Christmas, other than this past Christmas when I didn't have money, and
Mm.
I still got to do it.
Mm-hmm.
I would buy them, give them gift cards to Bath
Yeah.
and Body Works,
Yeah.
and give them a certain amount of dollars for however many years they've been with me.
I get it. Yeah.
Okay.
Let me ask you
Um,
a question. Since the two newer team members didn't say that was an issue, how do you appreciate those two? What are you doing to appreciate them?
well, other than buying lunch
Mm-hmm.
every once in a while,
Mm-hmm.
um, I mean, besides telling them that
That's okay.
hey,
No, including telling them. That's what I want
yeah,
to know. Yeah.
I mean, every meeting I start, I say,
Yep.
hey, look, this is my practice, but without you guys, it does not work.
Okay. Now that's group appreciation, which continue to do, but it's one-on-one appreciation that makes a separation. So
Mhm.
Gary, was it Gary Chapman wrote the book Five Love Languages?
Okay, yeah, that's
He translated that to at the workplace, the five appreciation languages in the workplace, or something
okay,
like that. Okay.
okay,
And so it's, touch, which that's not a workplace thing. So then it's the other four. It's words of affirmation. It is gifts, like you're talking about. It is acts of service, and it is quality time. Now, the funny thing is, most doctors feel appreciated through acts of service because you're doing your job. It makes me feel appreciated that you appreciate your job I gave you because you're doing your job well and you feel appreciated almost organically. Most
hmm
team members are either words of affirmation or gifts. The bonus, the lunch, the coffee, the Christmas thing, right? That's a gifts thing. And for me, I'm gifts, but I'm also words of affirmation. So if you just sent me a text every other week that said, "Wow, I loved what you did with Ricky Bobby. You really closed that case. You made a difference in his life. His smile is going to be amazing." Like if you sent me that, man, I'd feel like, wow, doctor really appreciates what I'm doing. And every now and then you throw me a bone on a bonus. That's good too, right? But I'm going to earn it. I'm one of those. I got to earn that. That's not really an appreciation. That's like, okay, I did a really good job this year or this month, and I got a raise or I got a bonus. That's kind of different for me. But the words of affirmation for me, that's big. So you need to know, what is Raquel, what is Taz, what is Angelique, what is Linda, what are their appreciation styles. You need to know that when you're one-on-one. You can ask them, how do you like to be appreciated? Is it more quality time? Is it more acts of service? Is it more words of encouragement? Or is it more gifts? They will tell you. So give me an example of when I've done a good job of appreciating you. Can you think of something? Because I want to do that for you. It's just being honest. It's great leadership. It's great leadership development for you. And it's going to help with retention of employees too. 68% of people leave their job because they don't feel appreciated. 68% of the people who stay say they do so because they feel appreciated. Same number, both sides. It's the vast majority of reason why people leave or stay. All right.
Okay.
Make sense? So here's what I tell all doctors. The moment you feel like you're appreciating enough, you're losing the game. In other words, you can't appreciate enough.
Okay.
You just can't.
Okay.
Hey, man. So my thing is good game, good game, good game. High five, high five, high five, high five. That was an awesome day. You know, or at the end of morning, let's go have a good game. Let's go have a good game. High five, high five. I don't know. I just like sports. You know, that's my thing. That's group encouragement. And then it's, hey, Linda, way to go. Man, that was awesome. I love what you did there. That was phenomenal with her. That was great. Could be with a team member to team member. It could be patient, whatever, right? Send a text message. Just shift it up a little bit. So it doesn't feel like you're just monotony. Make sense?
Yes.
Awesome. Awesome. All right. So
Okay.
next month, let's do this again, you and I.
Oh, you want to do a group?
Whatever you want to do.
Let's do a group.
All right. So next month, all right, we are going to do a group meeting. So we're going to schedule 2 months. We're going to schedule the group in March, and we're going to schedule me and you in April. Okay.
Good.
Next group. And I want to focus on case acceptance tracker. And let me look at my notes. I'm going to do 95-5 rule. You and I have talked about that before, but not with them. 95-5 rule. And we'll put here, eliminate limiting terms. Limiting terms. They will love that. Did we do limiting terms last time? Yes, we did.
We did.
We
but
did.
It needs to be.
Yeah, we can follow up. Okay, follow up, eliminate limiting terms. And scheduling new patients, the new patient call. Okay, so we will do that at our next meeting. So March. What looks good in March for you?
March.
With the team.
We can do a